हेलो वरुण, कैसे हैं?
अच्छा हूँ सर।
तो ये पहचान रहे हैं ये क्या था, कैसे था?
हाँ, ये एक एक्सीडेंट था
हम्म
जिसको आपने ट्रीट किया
हम्म
और ठीक किया।
सो ये जो आपने यू गॉट दिस ट्रांसप्लांट डन समवेयर एल्स, और कितने ग्राफ्ट्स आपने लगभग कराए होंगे, कुछ याद, इफ यू रिमेम्बर?
आई थिंक 2500
2500 के करीब
हाँ जी।
ट्रांसप्लांट, और 2500 in this area only, huh?
यस।
So I can see there were you can see there were a lot of gaps in
Yeah,
between.
there were a
Or
lot of
hairline
gaps.
was dreadful.
Yeah, it was very unnatural.
Very
So
very.
whenever I used to look in the mirror, I feel very like demotivated and
And you used to hide it.
demoralized. I used to hide it by like keeping my hair on the front.
So I mean, did you feel sometime कि भाई मैंने कराया नहीं होता तो शायद मेरा ज्यादा अच्छा
नेचुरल लुक मुझे
natural
लगता था कि मेरा नेचुरल लुक इट वाज मच बेटर देन prior to doing this treatment.
So yeah, this is very important. See, people who get a transplant done, this is a message for them. You know, sometimes getting bald naturally is more acceptable,
Yes.
aesthetically more pleasing, as compared to something like this where which looks horrible. Now there were gaps. There were two issues in this transplant. One was very, very, very unnatural hairline, and it was quite obvious, and you know, not looking great, not looking good. And then second issue obviously was this thing, the density. There were so many gaps in between. So first repair, I think 2 years back.
2 years back.
So there you were also a little skeptical about this कि क्या जाना चाहिए इतने के लिए एकदम से. We discussed. So then at that time we took out some grafts from there, this portion only. We took out some grafts from here, and we took out some grafts from the other side, and उसको अपने place किया. Plus for the gaps in between we did your FUT, जिसमें से हमने थोड़ा FUT आपका निकाला था. So this was the thing which was done in the first surgery. You remember?
Yes.
Yeah. So हमने आपके shave off भी नहीं किया था. That time unshaven transplant था. We just took this out because you had some assignments in hand and you had to meet people. So we just took out this and did the surgery. And FUT was done from back of your head.
Recovery was very good.
Yes. And without shaving off the donor, the recipient, we did this. So the FUT site also healed pretty nicely. And this was, I think, after a few days, after 7-8 days.
Yes, after 1 week.
1 week. So it was healing kind of pretty nicely. This time when you came, so at least some shape, not great shape, but at least some shape we could achieve at that time. The front also looks more dense now as compared to your previous pictures. And this portion, you are in a habit of hiding this side. Let me have a look if we can see. Yeah, from here if we see this. Yeah. So this time we decided to go all out for this because we had seen that it healed nicely, because this was a big region which we planned to take out. Now this time we took this out. We took the entire thing out using very small punches. The leftover hair in this portion. Did we do some extraction this time from back of your head? No extraction. Only frontal hair which were extracted, they were implanted in this portion. And we did this how many months back?
So in April.
So today is like September. So six months back. Now in 6 months time, if we take a look, this thing has healed up nicely, and the gaps we filled. This again was done without shaving off your head.
Yes, without shaving.
Yeah. So we minimized the social downtime, and this was your weak zone, which we filled. Although I insisted that we should get some softer hair and do this.
I was a bit worried.
Yeah, you were hesitant.
Yes.
So, but I think it is obvious when you get transplant like that.
Due to that.
So, okay, did you notice any difference between the work culture, the concern of doctor for you? Did you notice any difference between your previous surgery center and
Yeah, so there's a lot of difference. Like the way you explain the things, it's much better. You explain everything very clearly, pros and cons of everything in detail. that was missing in my previous case with the previous doctor. Staff is also very friendly, very helpful, and like not only related to this, we also talk in other about other things also. So you are very friendly, I can say, and like it's totally different from my previous experience.
Even if somebody gets this at a very cheap rate, cheap cost, would you recommend this type of transplant?
Not at all, not at all. Because
And
it's a wastage of money, time, and it also like it's not good for you. For your donor, wastage of your hair, scarring. So lot of issues related to this. So I'll not recommend.
And
this
what
product.
primarily can be done, in a fresh case, we cannot do in repair.
Yes.
Okay,
Agreed.
it has
Because in
limitations.
repair you have to take care of many things. So agreed.
Scarring and all that stuff. So I think the cheap transplants actually prove to be very costly later on.
Yeah, in later on in long term they will cost you a
And
lot.
secondly, even if you pay a lot of amount, even if you are not getting a cheap transplant, you are getting a costly transplant, it does not guarantee you that you get the quality. And again, if you get the quality, it does not guarantee that the quality which you are getting you have to see at what cost is it coming. Many a times you see results which are boosted by finasteride. There is a hair fiber topic which you can spray on the head. Now finasteride is oral topic. Oral topic means you eat finasteride, it will turn a lot of things black and you will see a lot of hair
Yes.
growing. Are you taking any medicine right now?
No.
Did we put you on finasteride?
No.
In like when we did this? No.
No.
You are holding up your hair pretty well.
Yes, pretty well.
So not everyone needs finasteride. Again, a very important point. But when you will have to check whether it's you who needs finasteride or it's the doctor who needs finasteride. Many a times, the clinic or the doctor needs finasteride more than you. So all the patients, suppose if you got this transplant and somewhere else, most likely you would have been put on finasteride from day one, post surgery.
Yeah, during my first transplant, they recommended me.
They recommended.
Yeah.
Now, if somebody is doing this kind of work, now there are a lot of miniaturized hair present in these areas also. Now, with finasteride, which is a perfect DHT blocker, these hair improve and the thickness and the gaps between hair, you'll see that these gaps improve. Okay, and the aesthetic sense, you'll see a lot of softer hair between these hard and coarse hair, thicker hair, multi hair. So the aesthetic of that area improves, the thickness improves, the coverage improves, the density improves. So did you take finasteride at that time when the previous doctor prescribed you?
For some time.
How many days? How
For
months?
around 2 months.
2 months. Did you notice any change at that time when you took it and then when you stopped it?
Yeah, so there was a bit of difference when I was taking it. My growth was bit good than when I left it.
So
here
when you left,
started.
the growth again became. So did you notice that the gaps which were visible, they became less prominent when you were taking finasteride?
Yeah, they were less visible, and when I stopped taking finasteride, then they are more visible. They were more visible.
That's the point. See, this is a very important point which I wanted to highlight. Because when such transplants are done, or not such, maybe better transplants are done, you are seeing an X result. That X result will look 2X when you take finasteride. And when somebody is not confident about the result, when somebody thinks that, okay, I'm doing it, but not sure, they will try to put you on finasteride. Not every patient needs finasteride. Varun, you got your first transplant at what age? I mean, how many years back, this transplant?
So around 5-6, more than 6 years.
6 years back. So 6 years back, he got this transplant done. And still he has excellent hair coverage in these areas. And suppose if he did not stop, I mean, he hadn't stopped finasteride 2 months after the transplant, after 2 months, he probably would have continued the medicine, and by this time the medicine must have developed tolerance, and you would have lost more hair. ज़्यादा बाल गिरते इनके अगर इन्होंने finasteride को उस समय लिया होता और बाद में या तो ये छोड़ते फिनेस्टाइड को लंबे समय के बाद, या ये फिनेस्टाइड इनको छोड़ती टॉलरेंस डेवलप होने के बाद। सो आप लोग जो लोग सोचते हैं कि फिनेस्टाइड एक बहुत मैजिक, मतलब दवा बहुत बढ़िया है, नो डाउट, बट किसको कब इंट्रोड्यूस करनी है? अगर 100 लोगों के ट्रांसप्लांट कर रहे हैं तो क्या 100 के 100 लोगों को दी जाएगी? अब ऐसा ट्रांसप्लांट करने वाले लोग भी जानते हैं, डॉक्टर भी जानते हैं कि फिनेस्टाइड दे दो भाई तो काम चलेगा। आई हैव टोल्ड मेनी टाइम्स, जो मेरा बाल काटता है सैलून में, उस बंदे ने भी ट्रांसप्लांट क्लिनिक खोला है। दैट गाय, द सैलून गाय हैज ओपनड अ ट्रांसप्लांट क्लिनिक एंड he was also telling me, sir, finasteride everyone should take post transplant and I give it, matlab we give finasteride to all our patients. So this is not the way, this is playing with life and emotions of patient. This should not be done. Every patient is unique, every patient is different, and one formula does not fit all. I mean, आपके आने से पहले मैंने डिसाइड कर रखा है मुझे आपको फिनेस्टाइड तो खिलानी है, क्योंकि मुझे मालूम है जो मैं काम कर रहा हूँ वो तो उतना कैपेबल है ही नहीं, वो तो काम उस लायक ही नहीं। आप मेरी जान खाते रहोगे कि भाई ये तो क्या किया आपने, क्या किया, बट ये सारी नाकामियां, ये सारी कमियां फिनेस्टाइड के खाने से छुप जाएंगी। आपने 2 महीने खाई थी, अगर आपने उसको 5-6 महीने खाया होता तो आप देखते कि ये, और किस डोज पे दिया गया था आपको, व्हाट डोज, 1 mg पर डे?
यस, 1 mg।
सो ये डोज भी इम्पोर्टेंट है, देनी है या नहीं देनी है, ये पहला सवाल। दूसरा सवाल, अगर देनी है तो कब इंट्रोड्यूस करनी है? इमीडिएटली ट्रांसप्लांट के बाद? आप वेट कर सकते हो सकता है आप देख लो भाई कितने बाल आपके उग रहे हैं, 6-8 महीने बाद खा लोगे तो कोई आफत नहीं आ जाएगी कि, या कि भाई ट्रांसप्लांट का कुछ नुकसान बहुत हो जाएगा, ऐसा कुछ नहीं होगा। अगर आप 6-8 महीने बाद भी फिनेस्टाइड को लेना शुरू करते हो तो भी आप अपने बाल तो तब भी बचा लोगे, वो जो फिनेस्टाइड ने बचाने हैं। बट हाँ, हो सकता है आपके क्लिनिक की या डॉक्टर की पोल पट्टी खुल जाए कि जो काम किया वो इतना ही था। हो सकता है तब आपको लगे कि हाँ जी ये तो काम बस थोड़ा ऐसा सही हुआ है, एवरेज, तो पता चल जाएगा। बट आप इमीडिएटली ट्रांसप्लांट के बाद खाते हो तो पता नहीं चलता, किसी को पता ही नहीं चलेगा कि आप कैसे पहचान लोगे कौन सा बाल ट्रांसप्लांट से होगा और कौन सा बाल आपका दवा खाने से होगा, आप पहचान ही नहीं सकते। तो इसीलिए इन चीजों को, चालाकियों को समझो। आप फिनेस्टाइड डॉक्टर के या क्लिनिक के दीवार पे लटकने के लिए नहीं खा रहे हो, आप फिनेस्टाइड खा रहे हो या नहीं खा रहे हो ये आपका डिसीजन है, और ये आपको देखना है कि आपको कब लेनी है। ऐसे ही नहीं मजाक हो रहा है और सबको दे दिया और मिठाई बट रही है कि खा दिया सबको दे दिया, नहीं नहीं, ऐसे नहीं चलेगा। तो take an informed decision, discuss with this. So either you can start finasteride before transplant, आप खा लो 4-5 महीना पहले ट्रांसप्लांट से, देखो आप में से आधे लोगों को तो ट्रांसप्लांट की जरूरत भी नहीं पड़ेगी, हो सकता है एग्जिस्टिंग बाल इतने घने हो जाए आपको लगे कि मेरे तो बहुत बाल आ गए। या फिर आप खा लो 5-6-8 महीने के बाद, देख तो लो आपने जो तक ट्रांसप्लांट के लिए पैसा खर्च किया है, जो आप सोच रहे हो कि आपने बहुत बढ़िया ट्रांसप्लांट करा लिया, वो कि वास्तविकता में कितना बढ़िया ट्रांसप्लांट है, क्योंकि यही वो बाल हैं जो टिकेंगे आपके, रेस्ट ऑफ द हेयर विल फॉल, जो आपके दवाई से हो गए थे वो चले जाएंगे, है ना। तो कई बार मतलब these things are important. First time when we did his transplant, you can see in the pre pictures there were a lot of gaps. तो ये सारे गैप कवर किए हमने। अब आप देखें तो ये कंगा नहीं जा रहा है, सी, एंड this is without finasteride. This is without finasteride. With finasteride things look different. So आप जो वो कंगे वाले रिजल्ट देखते हैं, जो जब आप देखते हैं और एक कंगा भी नहीं जा रहा है, ऐसे ऐसे हो रहा है, ऐसे ऐसे हो रहा है, वो सब फिनेस्टाइड के चमत्कार वाले रिजल्ट्स होते हैं। नाउ लुक एट दिस एरिया, दिस टेम्पल, सी हाउ ब्यूटीफुली दिस हैज बीन डन। देयर इज वेरी मिनिमल स्कारिंग, मोस्ट ऑफ द हेयर वी कुड एक्सट्रैक्ट, we recreated, I mean, though Varun did not allow us to recreate much, but yes, still it is in a very good shape after extraction. So it looks very, very nice and natural now. Look at the other side. So we extracted from here. There are still some hair left because this is difficult. All angles, different angles, and a lot of scarring. We did this extraction and then little bit from here, and then all these extracted, approximately 400 grafts. They were put inside and reused without shaving off the head. So now the look is like pretty good. A little work is left still where we can extract these, but the problem in these repair cases is the angle at which these grafts have been placed are wayward. Like, see these here which are inside the scheme of things now, but they are standing like this. So the ideal angle at this side should have been like this, but it is like standing like this. So that's a challenge. But in such cases, we cannot just keep extracting these grafts again and again and again and again. Now take a look at the donor area. So this is the FUT line which you see over here, and we it took it from FUE side. You can see the density was reduced, but the strip does not actually reduce the density, and we can easily just take it out. So was the pain a factor, like when you got this FUT? Then generally people say that
No,
FUT is
not at all. There was no pain.
yeah, and the best part was the entire surgery was done hidden. Like when we did FUT, we did not shave off anything from here, and everything looks perfect. Any message, Varun?
Yeah, so I would like to say one thing. Whenever you are choosing your doctor, choose it very carefully, because that will decide your result, and that will make a lot of difference in your journey of your transplant.
Yeah, and secondly, always choose a complete clinic which has experience and expertise and skills in doing both the surgeries, FUT and FUE. If you choose an incomplete clinic, only FUE clinic, then obviously you are going to get in trouble some point down the line, even if you think that you have a small grade of baldness, but it doesn't guarantee you that your hair fall is not going to persist. You may thin out, and obviously discuss your post transplant treatment plan, especially I'm talking about finasteride. Discuss how uh, is the doctor going to sustain, and what kind of things you need, and I hope things have become clearer to you, and thank you, and share this video with as many as possible, your friends, your colleagues. They may need this, they may fall trap to uh, you know to such ugly transplants and misusage of medicine, but if they get timely information, that is power, power to save somebody's hair, save somebody's donor, save somebody's time, and probably save somebody's life. Thank you. Love yourself and stay blessed.